Welcome to the Birth Breakdown, a mini-sode series from Her Birth, Her Story. These short episodes are here to open conversations around pregnancy, birth, and postpartum. Things I believe every woman deserves to look into, to question, and just to feel empowered by. This isn't about telling you what to do or what's right and what's wrong. It's about giving you space to think, to learn, and to trust yourself a little bit more as you prepare for your birth. Let's break it down. Today's episode, we're going to be walking through what actually happens in the first 24 hours after birth, in a hospital, a home birth, why this window is so important, what's routine, and just things that you can research ahead of time. And just a few things that might surprise a first-time mom. Because I feel like this is so important because we spend so much time prepping for the labor and the birth itself that sometimes the 24 hours after birth shocks you on all of the things that could be occurring. I feel like it's very important to look into the things that happen in postpartum so that you're not blindsided by some things that go on, because those first hours, they matter more than most people realize. Immediately right after your baby is born, it's something called the golden hour. And right after the baby's born, especially if everyone's stable, the goal is usually immediate skin to skin, delayed cord clamping, minimal interruption, and encouraging that first latch. I definitely encourage you to look into all four of these things too to see what fits best for you so that you know and are empowered in moving forward. Skin to skin is very important because this helps regulate your baby's temperature, stabilize blood sugar, regulate heart rate and breathing, and just stimulates oxytocin, which can be very important to help your uterus contract after the baby is born. Your baby is biologically primed to find the breast in that first hour, and it's often called the breast crawl. Some babies latch quickly and some don't, and both can be normal, so don't get freaked out about that. After delivery, this is kind of what happens in a hospital. First is your placenta delivery. You'll deliver your placenta usually within 5 to 30 minutes. Definitely make sure that you're looking into hospital policy. Sometimes they pull on your umbilical cord to make you have your placenta quickly, and I would just look into that to make sure that that's something that you want. If done too hard, not at the right time, it can just cause other issues down the road, like part of your placenta is still attached to you, or just look into it. Look into their policies as well. You may feel mild contractions again, and a lot of times moms have a fear of birthing their placenta because they just birthed a baby and you just went through the experience of that intensity, that discomfort, and the contractions come back because you're about to birth your placenta. The only thing that I can encourage you with that is I know that it feels very scary, but you are not birthing out a whole baby. It's a little bit different. It feels more like jelly if I were to explain it a little bit more, but just prepare yourself for that. Your provider is going to check for your bleeding, any tears or stitches that you need, and they're going to push on your tummy to see your uterine firmness. They may recommend you to receive Pitocin to prevent hemorrhaging, and I definitely would just look into this and talk with your doctor at the time to see if you are hemorrhaging or if they're just doing it as protocol, what your risks are. Many hospitals give it routinely, and some moms choose to decline if they're low risk, so this is something worth researching ahead of time. Next, they go into the newborn assessments within the first hour or two. They're going to give your baby an APGAR score, which is normally done at 1 and 5 minutes. They're going to take their weight, measure them, vitamin K injection, eye ointment, possibly the hepatitis B vaccine. These things are all standard in most hospitals, but you do have options. I would look into all of these things, why they're giving it and if it's beneficial for you and your baby, but timing can often be delayed of these things as well if you you request uninterrupted skin to skin for your first. And sometimes this is where a doula can be very, very beneficial too, or just making sure that somebody on your birth team stands firm on your wants when it comes to your birth, if there's any of these things that you want to decline, or if you really just want to soak in that golden hour. A lot of times moms don't realize that you can ask for procedures to happen while the baby is on your chest as well. It's your baby, so just know that you do have options. The first recovery hours too, you'll likely stay in a recovery room for about 2 hours before being moved, just because they want to check your bleeding, and they're gonna do a fundal massage, and that's definitely not comfortable. They're gonna monitor your blood pressure, and this is just to prevent the postpartum hemorrhage, which is most likely to occur in the first 24 hours, and just monitoring for any signs that are alarming before putting you in your other room. During your hospital stay, they normally keep you 24 to 48 hours, and what's going to happen during this time is there going to be multiple baby checks, multiple checks on you. They may send you a lactation consultant. Your baby's going to get a hearing screening, and they're going to make sure that they're tracking diapers and feeds. One thing that can be very surprising to first-time moms during this is you may not sleep much at all. Even if the baby's sleeping, you're constantly going to have people coming in and checking you, which can be really overstimulating. And two, if you just had your baby, you're probably on a high of, wow, I just had a baby. You're so excited and exhausted at the same time. So just be aware of that. Now for my home birth mamas, at home, the flow is usually a lot quieter and just more physiologic. And I can speak just from experience on both of these two things with my daughter and my son. And my son's postpartum was a lot more peaceful. My daughter in the hospital, just because you don't have people constantly checking you. And if you're low risk too, you don't really need to be interrupted that many times. But immediately after birth and a home birth, you have immediate bonding. The baby typically stays on the mom's chest for an extended period of time without interruptions. They wait to do the measurements and exams until bonding is established once you've latched. One thing that I noticed too was I had my placenta a lot quicker in the hospital than I did in my home birth. So your midwife monitors your bleeding, checks your uterus, and watches your baby's breathing and color, just like the hospital, but it's just usually with a lot fewer people in the room. And if stitches are needed, guess what? They do that at home as well. Then your midwife will perform a full newborn assessment within the first few hours. Vitamin K and other options can vary by provider and state. So it's definitely something to look into if you are wanting those things, to make sure that your midwife offers that service to you as well. For me, the biggest difference between the hospital and the home birth is that you don't go anywhere. You get to just be in your own bed, your own environment. There aren't shift changes. And what can be really surprising for moms is the adrenaline drop can feel intense once everyone leaves and it's quiet, and the emotional wave may just hit harder in that stillness. And in the hospital, I feel like you don't really get to experience that stillness as much as what you do with a home birth. Period matters so much because there are a lot of different things that can happen in this 24-hour time frame. This window affects your breastfeeding success, maternal bleeding risk, hormonal bonding, your baby's nervous system regulating. Oxytocin is very high during this time, and oxytocin is released through skin to skin, breastfeeding, just feeling safe, undisturbed, which is why minimizing unnecessary separation can be so powerful. This doesn't mean that a hospital birth can't be beautiful. It just means understanding how to advocate for yourself for a calmer environment if that's what you truly desire. And just remember, just because you're in a hospital does not mean that everybody needs to be taking your baby every single time. If they are taking for a reason that you don't feel is necessary or you don't want them out of your sight, you're allowed to say, no, thank you, and you can keep the baby with you. There are many things that they can do for you while the baby is still in your presence. If you're pregnant, there are a few things to research for this 24-hour period is delayed cord clamping, it's skin to skin, routine use of Pitocin postpartumly, your vitamin K injection, benefits and risks, hospital nursery policies, rooming in versus the nursery, lactation support, visitor policies. Just knowing your options ahead of time prevents that 2 a.m. Googling when you're so exhausted and you've done all of this preparation for birth, but now you finally have your baby and there's just a lot of things going on. So let's talk about some things that really catch women off guard, especially if they are a first-time mom. The shaking. Post-birth shaking is very common from hormones and adrenaline. It can feel really intense. It can kind of feel kind of scary, but it is usually normal. The after pains, especially with second babies, but even with your first, you may feel contractions while breastfeeding because that oxytocin is helping your uterus shrink. Normally, they're not as intense as obviously the end of your labor, but they can kind of come out of left field to where if you're not expecting it, it can be kind of a lot. No one talks about this and it can feel so scary or uncomfortable, but the first pee after birth. I just want to prepare you going into it too that it is not comfortable at all, and especially depending on if you tore or whatever, it can feel scary. Same with your first poop after. It can feel very scary anytime that you are bearing down because you just had a baby. You're literally thinking about that. So I definitely recommend you looking into some stool softeners or ways to help make that first poop a little less scary. Also, babies often clear fluid from birth in the first 24 hours. So if they're gagging or spitting up mucus, that can be alarming, but it's often a normal transition from being in the womb to now breathing on their own out in the world. Even if you had a beautiful, peaceful birth, just know that you can still feel emotionally raw. The hormone drop is real. The vulnerability is real. You may cry simply because it's just overwhelming, whether that be in a good way or in a very tender way. Also, cluster feeding can start immediately. Many moms expect just a sleepy newborn, and since they preach the baby will feed every 2 hours, some babies just feed very frequently in the first 24 hours, and this is normal, and it's just to help get your milk supply to come in. And I just want to offer you some encouragement in this first 24 hours because the first 24 hours are so sacred. Not because everything goes perfectly, but because you are meeting your baby for the first time. If you're planning a hospital birth, learn your options. If you're planning a home birth, understand emergency protocols too. Preparation doesn't create fear, it creates peace. And if your first 24 hours didn't go the way that you hoped, just know this does not define your motherhood. Bonding is not a 24-hour window. It's a lifelong unfolding. So if you're pregnant and listening, take an hour this week to look into your hospital or your provider's policy. Your birth doesn't end when your baby's born. Those first 24 hours after matter, and you deserve to feel informed, supported, and steady as you step into them. That's all for today's birth breakdown. If this episode sparked curiosity, affirmed something you've been feeling, or gave you a new perspective, I'd love for you to share it with another mom or mom-to-be who might need it. Make sure you're following Her Birth, Her Story, and if you feel called, leaving a review is one of the best ways to support this space, and it helps these conversations reach more women. Until next time, remember, this is your body, your baby, and your story. We are reclaiming birth one story at a time.